two.
Good afternoon, everybody, and welcome to the County Executive's weekly media briefing. My name is Barry Hudson. I'm the Director of Public Information for Montgomery County. I'd like to welcome you here today for another session with the County Executive. We're joined, as we have in the past, by Dr. James Bridgers, Sean O'Donnell, and Dr. Earl Stoddard from our Public Health and Emergency Management Group to provide updates on public health and that area. But we also have a special guest today. We're joined by Dr. Patsy McNeil, who is the Chief Medical Officer at Adventist Healthcare Systems. Just as a housekeeping piece, remember, if you have any questions, please put them in the chat and we'll recognize you in order for that. If you do need the ability to record and you have not gained that ability thus far, please again put that in the chat so we can take care of that. So without any further ado, I will hand it over to our County Executive, Marc Elrich, to kick off our discussion.
So good morning, everybody, and thanks for joining me. I know this is a day later than we usually meet, but I've been down in Annapolis the last 2 days, and we've been meeting with both party leaders and members of the 2023 Maryland General Assembly. The clock's already ticking on the short 90-day window of this session, and there's some things that I'd like to say about our state government. And the first is it's a very different feel in the air after 8 years of having a Republican in the governor's house. We're looking forward to not having to fight uphill to accomplish our legislative priorities. One thing that's really been important to me is we know with the Moore administration that myself and many of the other Democrats around the state share common goals with the issues that the governor-elect raised during his campaign and that he continues to talk about. And those kind of commonalities, the fact that we've got in large measures a shared agenda, makes the conversations very different. I mean, ultimately, money is always going to be a part of a conversation, but it's good to know that deciding what to do and what are the priorities, what's the most important things to focus on, those are things where we don't have to have a debate about. And so all of us will look for solutions to try to fund the things we need to fund, but at least we're talking about in a kind of common way about what are the most important things for the state of Maryland and for Montgomery County as we move forward. We're lucky to have the largest delegation in the state once again. Now we have 35 senators and delegates representing the county. And this week, Senator Susan Lee was appointed as Secretary of State, joining Delegate Lutke as in the Moore administration. So these are two of our current leaders in the House who've been moved into state positions, and Senator Lee from the Senate. And it's going to be really helpful to have them there. Susan's going to be the real ambassador for this state, and I'm very happy to congratulate her on her appointment and thank her on behalf of everybody in Montgomery County. Our delegates and senators who succeeded over the last few years through collaboration now have cohesion. Montgomery County will be seeking state assistance on critical projects to propel our growth and boost what is recognized as the economic engine of the state, starting with our bus rapid transit system and the Institute on Health Computing. We're building on progress of the last legislative session, and we're working to increase state support for our comprehensive bus rapid transit system to link more of our neighbors to business corridors across Montgomery County. There's also new discussions in the State House and around Annapolis to focus on the environment. We've set a great example here. I will say I got compliments from a number of the new delegates who had been on a tour, and I had met at one of the county transportation facilities, and they're really impressed with what we're doing. And a lot of people are asking, well, can't we do this where they are? And that's a good thing. We talk, Montgomery County about wanting to lead by example. Being able to show people what we've been able to do is a good example of leading by example. So I'm optimistic right now. And I'll be sharing updates on bills and issues that I think are going to be able to help Montgomery County. The most important data point we've consistently monitored since the beginning of the pandemic is the stress that our hospitals are operating under. And when our hospitals are too overwhelmed with patients, there are long delays for those needing care and beds not available for those with urgent needs. And when our ambulance turnaround time at hospitals is reduced, that means those ambulances aren't going back on the streets of Montgomery County where we need them as quickly as we need them, because they're off the street still trying to get their patients into the emergency rooms. So these are real world consequences and residual impacts when we think of COVID, flu, and RSV and the other health maladies that impact our hospitals and their very hardworking employees. Compounding these capacity issues are staffing shortages that continue to impact our hospitals' abilities to serve patients. These staffing shortages, stretch across hospitals, but they also go to clinics, to people trying to find social workers and mental health workers. The shortages in these fields have really begun to impact everybody's ability to deliver services. And I know a lot of people are looking for ways of alleviating the shortages and ways of approaching some of these problems on a shorter timeline than we traditionally do. This week, the Maryland Hospital Association reported that hospitals around the state are at 90% capacity and some are completely full. And along with that warning came a new directive from the group for the public to think about when is a hospital visit needed. If a family physician or telehealth visit or visit to urgent care can alleviate an issue, then it is absolutely preferred right now. For life-threatening issues, going to the hospital is still advised. But if you have something that could be taken care of just as easily in a clinic or with a doctor's visit, please don't go to the hospitals. The burden on their emergency rooms is pretty severe right now. This ties into our COVID health update, because the percent of patients with COVID-19 and new COVID patients continues to account for more than 10% of hospital beds. And it's why our community status has been medium for the last few weeks. To put it into context, we're nowhere near close to the transmission levels we saw this time last year. But as the warning indicator, COVID-19 is spreading and concern is elevated. So I'm going to take a moment now and introduce you to Dr. Patsy McNeil, an emergency room physician and chief medical officer at Adventist Healthcare System, to give you a better idea of what hospital systems are dealing with right now. And afterwards, we'll take some questions from the media on this topic, and then we'll go back to the rest of the briefing. So thank you for joining us, Dr. McNeil, and I look forward to hearing from you.
Sure. Well, good morning, everybody. And so I'm sitting here currently in one of our flagship hospitals for Adventist Healthcare. I'm in Shady Grove Hospital Medical Center right now. And I have to say to you that based on rounding and speaking to our physicians and knowing our census, which we keep a very close eye on across our hospital system, we are busy. We are busy. And I think there's a disconnect a bit between when I go out into the public, when I go home and I'm in Montgomery County or Arundel County or down in DC or Baltimore, a little bit disconnect about how people perceive COVID a bit. People are often maskless. People are often very close to each other and, not really cognizant of the importance of keeping boosters up to date, for instance. And I will say that, for instance, across Adventist Healthcare, we're managing, but our workforce is very tired. When we speak of COVID right now, we're very blessed to have the alternative care site at Tacoma Park, which Adventist Healthcare runs, but it's run for the state, of course, to relieve some of the burden for hospitals regarding COVID patients. 2 weeks ago, their census there was 60 or so. It's 90 now. And so COVID is very, very real. It is very, very still much out there. We are seeing that a lot of our patients, especially the ones who are particularly ill on breathing apparatus or vented, they are majority-wise, if not completely, those who are unvaccinated. And so I know that there is vaccine fatigue amongst those out in the community. I myself do not like or enjoy getting shots, but it is very important to keep up with those boosters to keep yourself healthy. And It's not only about oneself being healthy. We all are in contact with people who are elderly or cancer patients or otherwise immune compromised. And so for the community benefit, it is a citizen obligation, I believe, at the highest level to make sure that your vaccinations are up to date so we can continue to protect the community. At Adventist Healthcare and across, when I speak to my colleagues who are chief medical officers at other institutions, such across at Holy Cross or down at the hospital center in MedStar, we are concerned about COVID and the flu. RSV has started to take a bit of a downturn, so there's a little bit of relief there. But as far as respiratory viruses, there is a burden in our hospitals right now that keep all of our healthcare workers on alert and working hard on your behalf and on behalf of the community. And I want to remind folks that one of the effects of the pandemic has been that folks have delayed their healthcare, which means that in your acute care hospitals right now, not only are we battling the respiratory virus, but we have other patients who do not have COVID who are extremely ill. The acuity of the patients that we have on our inpatient units that are packed right now with both virus and non-virus folks is keeping everyone really working at the top of their license, at the top of their abilities. So operationally in our hospitals, COVID is still very real. The effects of the pandemic on other illnesses because of delays is very real. And then we deal with, of course, our workforce issues, which were referred to just moments ago. Our workforce in healthcare, everyone who's working right now wants to be there. If they did not want to be there, as has been the cases we've seen over the last 2 years, they have sought other ways to employ themselves or to be employed. And so when you're in the hospital, you're looking up into the face of a new nurse or a doctor, all of them are wanting to be there and serve our community, but they are tired. Across the United States right now, burnout for physicians is at 56%, a little bit better than that at Adventist Healthcare, but believe you me, there's never been a time in my 26 years of being a doctor of having it be quite this difficult to take care of human beings. Resources are low, work staff are low, and we are having to be ever innovative in how we take care of people. Healthcare in particularly is not built to not have human beings take care of human beings. And so when one is ill, it's not just technology, which we have plenty of, but it takes a human being to hold a hand, to explain things to folks, to be sure that things are interpreted properly, communicate to consultants, to other doctors, to nursing staff, to CNAs and other ancillary staff in hospitals. It is definitely a village of care that it takes, and there is no way around not having human beings to do it. So we are stressed as far as workforce is concerned. We've worked very hard to make sure that folks are taken care of so that they can have time off, so they can have time off stage. But even so, with the acuity of patients, it's very, very difficult right now in our hospitals. And so also to the commentary about being wise about how we choose to go to our emergency department, you'll get taken care of. No matter what you come for, you will get taken care of, but there will be a delay if you are not as sick as someone who may be ahead of you, okay? So our elderly folks, our other infirm, our folks with acute problems that affect their breathing, their heart, those folks are gonna take precedence over other issues. Doesn't mean you shouldn't come to the hospital, but if you have an outside primary care doctor you can call and come into the next day. Sometimes urgent care is a choice as well. It's just very important to be prudent about how we go forward here. So I'll just say in summary and leave room for others to speak and for questions to occur. You know, your healthcare workers, your hospitals, your hospital administrators, your doctors, your nurses, people who greet you at the door, registration, everybody in healthcare right now is stressed and working very, very hard. It's not like we can't do it. It's not like we have a calling and a way about us that means that we're going to meet whatever challenge that comes forward. But it would be an understatement to say that we don't need your help. We do need folks to continue to get vaccinated. We do need folks that they're going to be in a large crowd, particularly a family who have elderly or folks who are immunocompromised. Please go to your local drugstore, get a COVID test, and do that before you're all in each other's faces in a warm space when it's cold outside. and really, really consider masking when you're inside of a building with a lot of people around, because it's not just you we have to worry about. It is evidently those who are not vaccinated, those who are immunocompromised, those who are elderly and otherwise at high risk is what I would say. So that's my summary statement about how things are going in our hospitals, our workforce. Respiratory virus has not gone anywhere. It's still definitely there. It's important to get vaccinated. It's important to think carefully as you go into our emergency departments, not overstress the overstressed already.
Okay, thank you, Dr. McNeil, for that information. We now are going to open up the floor to questions specifically for Dr. McNeil and the hospital situation. So if you do have questions, please drop them in the chat. We'll give you a few minutes to do that if you have any. We do have a question from Heather Curtis from WMAL. Heather, go ahead.
Hi, thank you so much, everyone, for taking the time. Dr. McNeil, how short-staffed are you at this point? And do you anticipate having to implement a surge plan if these hospital numbers keep increasing?
Absolutely. We have plans that we've had the unfortunate need to implement in the past. Omicron was definitely quite powerful in the last winter, not to mention the 2 years that preceded it as well. We have surge plans that are definitely available for us to implement. Our system has a way of looking at metrics to trigger, for instance, the entire system to come together to look at what we're doing, what supplies we have, and what we need to do. As far as short staffing, we do, we have our own employed staff, and then there are called agency or traveling staff. We make sure that we have exactly the number of staff by what means we have to staff our beds. And so we're not short, we're just not abundant as was in the case in the past. We do need to have more resources to let those who are working rest more. So breaks, to go and take care of one's personal needs, having lunch breaks, things like that are the things that sometimes begin to suffer a bit. But we aren't what I would call as short staffed. Omicron was definitely a difficulty last winter, where we had so many people calling out that it was, I've never been quite that pressed to be innovative in how we cover care. I'll say that. It's not quite there now. We want not to get there again. We make sure that we cover the beds that we have in our hospitals.
Thank you. And I'm wondering, just one follow-up, what percentage of beds are occupied by COVID patients? And are a lot of people coming in with other things and then being diagnosed with COVID, or are people just coming in with COVID?
No. So I'll say this, the COVID patients that we have, the ones that are often in our intensive care unit and critical care, they're coming in with COVID, and COVID's the main reason that they're there often, and they have other reasons to be ill as well, but that is the issue. But a large number of our COVID patients are there for other reasons and then happen to also have COVID for sure. As far as percentage of beds that we have with COVID patients, we are across the system, and it varies from hospital to hospital. We have 4 acute care hospitals in our system, plus an acute rehab hospital, plus other facilities as well. We are about, I would say 10% or so, we're right around that. So we're under that, depending on what entity that you're talking about. But a reason that we're under that number really sits with one reason, and that is because of the state-funded alternative care site. And so when we have patients that are COVID positive, they're diagnosed there, they're stable enough, they can be transported to that site that really focuses on the care of COVID patients. And so it relieves the operational burden on our acute care hospitals. If that was not in place, we would be well over 10%. I would say that, with that 90 folks sitting in that hospital right now.
And if you could just remind me, and where is that alternative site?
Sure, it's in Tacoma Park.
Great. Thank you so much, Dr. McNeil. I really appreciate your time.
Anytime.
We also have a question from Jenny Bixby from Bethesda Beat. Jenny, go ahead.
Hi, thank you, Dr. McNeil. I had a question. I think a lot of people are under the misconception that if they've had COVID once, like a lot of us have, like I had back in April, that if they'd have COVID once, that they're less likely to get it in or that it won't be serious. But from my understanding, it can be even more serious or just as serious. There's still a risk there. Could you maybe talk a little bit about why it's important to keep being cautious, even if you've had COVID before?
Absolutely. The way the immune system works is you have an assault by anything, and I'll just say the virus because that's what we're talking about. Your body does have an immune response that gets antibodies, that gets you prepared to not have to fight off that particular assault again, right? The virus, this virus in particular, all viruses, they evolve over time, and so they work around your immune system because they just try to survive. In simple terms. And that means that in the evolution of the virus, there will come a time when your body has not seen this particular variant of the virus. And so if you have had COVID 2 years ago, you absolutely can get COVID now. And that is why also in many ways the vaccines are changing as well, because they have to keep up with that evolution. So if one has had COVID, there is a time where it's likely that the variants around you are the ones similar to the one that you have had, and you're likely to be a high immune response for, I'll say, 90 days, 3 months or so. But that is about it. After that, you can absolutely get COVID again. And even before that, if there's a new variant that comes from overseas or comes from across the United States somewhere that you have not experienced yet. So once it is unfortunately not a silver bullet to have it once. You most definitely can have it many, many, many times. I'm one of the rare people I know who have yet to have it. So I think any minute now, despite being vaccinated, I think 94, 95% of the folks in the United States have had it. So it will come to us all. However, there are things you can do, but there is no avoiding it if you're not precautionary.
Thank you, Dr. McNeil.
Sure.
Okay, any more questions for Dr. McNeil? All right, being none, Mr. County Executive, we'll hand it back to you to take us into the health update.
Yeah, thank you very much. Thank you, Dr. McNeil. That was really helpful. I really enjoyed your commentary on this. So this is the final week to apply for phase 4 of the rent relief program that's intended to help families struggling with COVID-19 challenges. And people have through midnight on Friday to submit their applications. This program was funded with federal money, and the federal government stopped renewing or adding funds to this program. And so we are spending out the last of the funds, and our HHS staff believes that we have enough applicants that we're currently processing that group will use up what remains of this rent relief fund. So they didn't want to have more people register only to find out that they're not going to be able to take advantage of the funds. It was meant to help families dealing with job loss or extraordinary medical expenses tied to COVID-19 health crisis. And that was probably one of the frustrations for people who applied but weren't accepted because their job losses didn't have anything to do with COVID, and they didn't have a COVID-related health crisis. One of the requirements for this money also included being at least 2 months behind on rent payments. Once the application period closes, cases will continue to be processed, and it's based on priority factors, including income, eviction risk, geographic location. And since the program began, about 1,400 households have received approximately $92 million in help. State Department of Health and Human Services is closing the program because the administrators expect the rest of the money allocated for this kind of public expenditure is going to be approved on it will be approved with the current group of applicants we have. While we're reaching the end of the federal money, there are some funds the county continues to have as our normal course of business. We're continuing to offer eviction prevention services, whether those hardships are COVID related or not. And for those in need of immediate help because of an eviction, we urge them to call 311 to request housing stabilization services or visit the Department of Housing and Community Affairs website. We asked for more state money. We weren't able to get it. We had hoped the federal government would continue to provide funding, but that has not materialized. So I think all of us regret the fact that this source of money's been gone. It helped a lot of families get through COVID, but we're not completely through it yet, as we know, at least particularly the economic impacts. On to the health update. In the past, our communities responded extraordinarily to our calls to protect themselves with vaccines and boosters. Montgomery County was the first major jurisdiction to reach more than 90% full vaccination rate. But now that our best defense of COVID is the bivalent booster, less than 1 in 3 eligible residents has gotten one. As you can see by the chart, the uptake on this is much higher the older you get. So our population of people above 65, we're at about 62% of those folks vaccinated. And when you go down to 50 to 64, we're at about half the population. But then between 18 and 49, it drops to 37%. And between 12 and 17, it drops to 31%. So the younger folks are not getting vaccinated at the same rate that everybody else is getting vaccinated with. And even in our senior population, which got to 100%, pretty quickly, we're just not there yet. So hopefully we'll see increases in that population. I did misstate the number for 65 plus. It's actually everybody. It's 54%. That chart you're looking at breaks down vaccination rates by ethnic groups. The chart we're sharing on the screen is a new graphic, and we made this week that helps break down who's gotten the bivalent booster by age and race. And I'm glad we've got this new graphic. It's good news about the senior population, not as good as it could be, but we really are encouraging people to go out and take the bivalent booster. As the doctor said, this is about keeping people safe from the worst effects of COVID, keeping people out of hospitals. We know that the various variants have been able to bypass complete immunity, so people are still getting COVID, but the severity of what they get is a lot different generally than the severity of the infections that the general population that's unvaccinated might get. So I'm going to turn this over now to our health experts available this week, Sean O'Donnell, for their thoughts on the current situation.
Thank you, Mr. County Executive. So to take you through some of the numbers that we're looking at, our PCR data for transmission rates has showed a steady increase over the last several weeks. You do see a couple drops there. That's likely weeks where testing was significantly limited because of the holidays, but the transmission rates have gone up. Our test positivity rates continue to climb. Very, very high test positivity at the county sites. We had a day this week where more than 40% of the tests that we sent to the lab were positive. So we're definitely seeing higher transmissions. As you can see, our percentage of hospital beds with a COVID patient, whether that's their primary diagnosis or a contributing diagnosis, that continues to climb. A reminder, the CDC's levels that they use for definitions, 15% at this transmission rate would be a high community level. So we are monitoring these closely. We are recommending, we're making public recommendations, and we have for many weeks now, for people to protect themselves, because we are seeing high transmissions, we're seeing increased hospitalizations. Our emergency departments, we do track through our syndromic data, emergency department visits. These are the total number of visits to emergency departments for any reason. You can see very high levels of emergency department visits recently. Again, rivaling what we've seen even in last year's Omicron. A little bit fewer inpatients, as was noted, but again, this volume is why there's wait times. It's why we're, those are great recommendations that if you do not have serious illness, and you can call your physician or you can stop by urgent care to get checked out if it's a more minor illness. That's a great idea, rather than going to the emergency department. Certainly if you have life-threatening or very urgent needs, then we want to preserve that resource for those individuals so they can be seen more quickly. Looking at the emergency department visits by age group, again, you can see they've come down quite a bit from those earlier RSV-led visits in our younger populations, but we have a very elevated number of visits currently for our 65 plus. A lot of this likely related to COVID infections. A lot of the news articles that are out there and a lot of the monitoring from public health officials is on the variants and the XBB variants growing very quickly. It does appear that this is one of the most transmissible, if not most transmissible variants. And certainly that seems to be a repeating story with each new variant. The reason they emerge is because they are more transmissible. Again, we're tracking on this. It's consistent with what we've reported the last several weeks in that related to these variants, it does appear that the vaccines are effective at reducing serious illness, and the antivirals like Paxlovid is effective at helping to reduce serious illness as well. So we're still recommending people, again, get vaccinated, and if they're at risk for serious illness, as soon as you have that positive diagnosis, contact your healthcare provider and inquire about Paxlovid. Again, like we've said before, the monoclonal antibodies appear to be less effective for these variants. I know we've talked about the hospitalization, so I'll skim by that, but you can see, again, we're at as high a level of inpatients with COVID diagnoses as we've had going back to the really big spike of Omicron last winter. Our mortality data, again, is showing elevated mortality related to the increased number of transmissions, increased number of hospitalizations. Again, the RSV appears to now have receded back to the pre-spike levels, and influenza has now shown across the U.S. Multiple weeks of continuing decline. It's still at an elevated level. It's still a risk, but it is starting to recede from where we were before. We're up to now 33 deaths across the state of Maryland from influenza. Finally, again, we've had another week with no cases of Mpox in Montgomery County. This has certainly slowed, over the last few months. So we're happy to see that, and we're preparing for a possibility of reemergence sometime down the line, but we're still providing vaccinations within Montgomery County to individuals who are at risk. And at this point, happy to see if we have any further comments from Dr. Bridgers or Dr. Stoddard.
Thank you, Mr. O'Donnell. No additional comments. Just want to thank Dr. McNeil for Washington Adventist partnership throughout the past almost 3 years now. You've been a stalwart in the community in our partnership, and principally laid it out nicely where we are this year as opposed to last year with Omicron. But we're still there nevertheless.
Absolutely. No, happy to be here.
Dr. Stoddard, anything from you, sir?
No, no additional.
Okay. All right, reporters, we are now taking questions for the county executive or any of our public health professionals here. I do have a question that came in to me via text from Derek Ward from WRC. He's not able to get in, so he texted me his question. And his question is for the county executive. It is, Mr. County Executive, he has a question about the COVID rental relief fund. In your mind, has it been a success? And what is next? You're muted, County Executive.
Yeah, I felt it was a success. I mean, as many people as we were able to help was really important. I wish we could have done more. I mean, we not only limited the number of people we could serve, but we couldn't serve everybody who actually had job loss. We limited, as many other groups did, to the people with the lowest incomes who suffered job loss. So we only scratched the surface of potential recipients of these funds. So I guess what's next is, I will continue to hope that, the governor or the federal government looks at the situation. I know Montgomery County cannot be alone in this, and might consider some additional relief coming out from the federal government. We have, some funds available. We can't match the 93 million that the federal government put in, but we'll continue to look at what else we can do to help forestall evictions due to COVID. And we're hoping that that people realize the importance of getting back into the job market, that with this relief not available, we're hoping that there's an uptick in people who are able to get jobs now, hopefully with the recovering economy. And that is based on a partial hope that the recession is mild. If we get a recession, the more people are able to get back on the ground and be able to get work and not have to rely on the relief right now. But it's unfortunate that it's ending. We do have emergency programs.
Several weeks.
Okay. I believe, Heather Curtis, did you have a question for Sean? Heather?
Can you hear me now?
Yeah, you have a question.
Thank you
for
so
Sean?
much. Yes, Mr. O'Donnell, I'm wondering, given the increased level of community spread, the increased number of tests coming back positive, how concerned are you that we may jump into the high community level as defined by the CDC?
Well, it's a very, very distinct possibility by the time we do a next press briefing that we may have entered that area. The trends are certainly pointing in that direction. This is the criteria CDC laid out again are general guidelines to localities on things to think about when you get into those areas. But one of the measures, which is the community transmissions as measured by PCR tests, when these measures were put out, was at a time where rapid tests were only sparingly available. And now that they're highly available, especially in our county, we know a lot more people are doing those. So again, we take those numbers with a grain of salt. There are times when we can move from low to high within a matter of days, but we are certainly on the edge of high, and it's distinctly possible that we are there within at some point this week. The guidance that our department's been putting out has been consistent with this. The one major difference in the CDC guidance between medium and high is that once you get to high, they're recommending that everyone wear masks when they're in public spaces. They're not saying that you need to mandate it, but they are making that recommendation that it's that at that level, that is a consideration you should make. They also reference considerations of how to handle that healthcare surge. And that is why we're in conversation with our hospitals about how they're being impacted and making sure that we can help to let the public know that the wait times are impacted and what the public can do to help reduce that burden on our healthcare system. Again, the one further thing is, as we've mentioned, our concern here with a highly transmissible variant, it's impossible to stop all infections from happening. And with high levels of vaccination and hopefully increasing levels of recent boosted vaccination, those infections will be less serious. But our greatest concern is with populations that are at higher risk for severe illness, our seniors and our populations with underlying risk factors. And again, if you have underlying risk factors, it's recommended, even at this point, talk with your healthcare provider about how serious your risk is and whether you should be wearing a mask when you go to public places, what your outcomes might be. If you test positive, should you consider immediately going on Paxlovid? Those are the conversations we recommend people have with their healthcare providers now if they're at increased risk.
You had said that if we do jump into the high category, the CDC recommends everyone mask up. I know that Dr. McNeil said she's going out into Montgomery County. I know I live in Montgomery County. I'm going out in Montgomery County. And even though our county has been so vigilant, it seems like a lot of people do have COVID fatigue. You don't see as many masks as you did last winter when we had the Omicron surge. Are you concerned that people just maybe have such COVID fatigue, they're not taking it seriously enough? And at that point, do you think that a mask mandate may need to be put in place so that people are, I hate to say it, but forced to take precautions if they're not taking them on their own?
So Heather, great question. Sean, I'm gonna jump in here because I've had conversations with our health officer, Dr. Davis, who couldn't join us today. So again, Heather, we've been keeping our county executive up to date, and he's waiting for us to provide guidance as we've done before. Dr. McNeil talked about not only fatigue in the healthcare setting in the workforce, but we continuously address the challenge of COVID fatigue, COVID hesitancy, COVID apathy, and so we're looking at that. More education, our aggressive push to have more folks vaccinated, but our health officer is prepared to issue another health officer advisory with those recommendations by the CDC on what to do when we've moved from a medium level to a high level. It's an additive measure that we've implemented before. Back in July, when we saw mid-July, we saw our cases rise above 264 cases per 100,000. It was a brief period, but some of those lessons learned through that period, we are prepared to implement it. We've increased our conversations with our hospital partners, with our congregate spaces, with our school settings, and so we are making those strides to examine where we are and assess using, as we've done before, data and science. So right now, not emphasizing a mask mandate. It's an individual choice. Dr. McNeil indicated that, and Ms. O'Donnell indicated that we have rapid tests more readily available now. If you're going in spaces where that it's crowded, it's more likely now with an increased case count that that you could become infectious or have a reinfection. Wear a mask. So those are some of the educational outreach pieces that we're moving for now.
Thank you.
Okay. Do we have any more questions for any of our guests here today?
It looked like Jenny Bixby had more questions. She put a second message out after the.
Okay. All right. Jenny, you have another question?
Yeah, thank you so much. These are for Mr. Elrich. Today, Will Jawando and Julie Polakovich-Carr are giving a press conference on the Tax Relief Act that they're sponsoring. If it passes, would you plan to support raising the maximum income tax rate, excuse me, in the county by 0.5%?
Yeah, I've talked with Julie about this before, and I told her that I would support that if they put it in. It doesn't raise the rate, but it gives the county the ability to raise the rate. We don't have a progressive tax system, and it's a problem. And I'm a firm believer in progressivity, and we'll see what the fate of this bill is in Annapolis.
Thank you. I do have another question. I'm going kind of on a different, taking a different angle. Unfortunately, it's been almost a month since a gentleman was shot and killed in a parking garage in Silver Spring. Has the county been thinking about how to kind of strengthen security measures and efforts when it comes to crime in the Silver Spring area? What will that look like in the new year?
Man, I wish I had a bunch of handy statistics to use right now. I don't know if Earl's got anything, but up until that, we had seen, decreases in crime in Silver Spring over a comparable period a year ago. And if you go to Silver Spring, you'll see things that you've never seen in Silver Spring before in terms of efforts to, whether it's license plate readers or street cameras. We put a lot of investment into dealing with crime, making it harder to commit a crime, making it harder to get away with the crime if you do commit it. And we're going to continue to do that. We are looking at things that we can do that would further reduce the prevalence of crime, not just in Silver Spring, but there are other communities that, have experienced upticks as well. That said, the police department continues to struggle with shortages that began a number of years ago. And we've, I've said this before, I tried to raise the police pay 2 years ago because we understood pay was a deterrent to officers coming here because we had fallen very low on a comparative scale, but we weren't able to raise the pay then. That was not something the council agreed to. So this is something we got last time around. Our recruit class did increase over what it had been before. And we're discussing again, as almost literally as we speak, what else we can do to increase police recruitment, both from other agencies, but also new recruits coming into the department. Our ability to provide the kind of coverage that we'd like to provide, and I think Chief Jones raised or mentioned this the other night in the discussion, is handicapped by being down, I think, over 120 police officers in terms of your count. So obviously, if we had more officers, we'd both have more flexibility, but we'd have more general coverage as a base. So we continue to work at that, and we are not limiting our classes to 20 or 30 people. We will have classes as large as we can possibly make them if we get the recruits, and we'll have them. If it means we have to do 2 a year, we will be doing 2 a year to bring the staffing up to the level it needs to be.
Thank you.
Yeah, I'll just add a little bit there. So we saw in 2022 relative to 2021, we saw both a decrease in homicides from 32 to 22. We saw a reduction in contact and non-contact shootings, and we also we increased the number of illegal firearms taken off the streets. So there was progress made in several areas. There remain issues in carjackings, thefts from theft of auto parts, and some other crimes involving property and persons. So we have more work to do. County Executive alluded to several measures that have been taken in downtown Silver Spring. I also want to note particularly that homicide that occurred in Silver Spring was particularly grisly and heartbreaking for a number of reasons that we've already talked about. But it should be also noted that was the only homicide that occurred in downtown Silver Spring in 2022.
Yeah.
So we made a full 11 months with one, that was the only homicide in the full 12 months of the year. Often Silver Spring is given a I don't want to say a bad rap in the sense that there are crimes from White Oak or further up New Hampshire Avenue that are not Silver Spring addresses that are associated with Silver Spring, and in part because it's a Silver Spring district, meaning the district name is the Silver Spring Police District, when in reality it covers a broad swath of the eastern half of the county, or eastern portion of the county, and includes many other communities besides Silver Spring. And so we take some issue with the classification of the crime that occurs in Silver Spring, as some of it is Silver Spring crime and some of it is not. It's unfair to the residents and businesses there to have everything be painted the same way. That said, it's not just a terminology issue. We obviously are still focused on addressing a number of issues. I think you're actually going to see some legislation, for example, to address that's going to be submitted over to the council that will look at some of the late night safety issues that we still see. We're obviously looking for more opportunities to increase patrols and other high visibility police details to deter crime. We're putting more resources into addressing homelessness and mental health, not necessarily because homelessness and mental health are generating crime, but because they are often calls for service that the police officers have to respond to, where a person is getting a police officer when they really need a mental health, a social worker, or someone to support addressing their homelessness issue. And that's a call for service that's diverting police attention from addressing and preventing violent crime. And so we're looking at ways to, to improve the availability of police officers by having them spend less time doing things that they're not well equipped or resourced to manage in the first place. And so we're trying to take a very holistic look at how we make our resources in law enforcement more available, recognizing that recruitment and retention are issues that we have to address over a longer period of time, but they don't address the immediate needs that we have and won't until we fill those spots. And so I think we're looking at it this is a holistic way, and the technology improvements that the county executive alluded to are a big part of that as well. So hope that answers.
Yeah. Absolutely. Yeah, I was going to follow up and just, if either of you can speak to it, something I'm interested in is, and you touched on this with the geographical part, but do you think that there's a misconception that there's a higher rate of crime in Silver Spring because of people's prejudice and misconception over which areas are more affluent or not?
I would say that being in the public safety space, when there's a crime in Bethesda, it's viewed differently than when there's a crime in Silver Spring. I would say that's factually true. I would say that, and some of the people who make the loudest points about Silver Spring are doing so in a way aimed at putting down the community as opposed to building it up. I think that is, that's the way I see it. That's my opinion. The county executive may feel differently than that, but having been watching social media in the space there and looking at the comments that are made when there's a crime that occurs in Bethesda versus a crime that occurs in downtown Silver Spring, the response on social media and the commentary is different. And I do think there are some racial undertones to some of that, and there are some other undertones I just don't think are affluence, everything you mentioned. I think there are some undertones there that I do think are different between crimes that occur in different parts of the county.
Thank you.
I would agree with Dr. Stoddard's comments on this. I mean, it is treated differently. There are perceptions that go back a long time, a very long time, that treat Silver Spring different than other places. I mean, there was somebody once referred to Silver Spring during its period of economic decline as looking like Beirut. It's like, I'm sorry, it never looked like that. So while Silver Spring has struggled economically, it's struggled economically more because of disinvestment and a new way of doing business than anything else. So we struggle with that. Having Silver Spring encompass this huge part of Montgomery County, there is no other area that carries the name Silver Spring that rivals the size of Silver Spring. And so anything that happens is reported as Silver Spring. It doesn't come with White Oak or Burtonsville or other parts of the county. Everything is Silver Spring. So they carry a load that doesn't reflect, the true issue of what's happening in downtown Silver Spring. I find myself asking when I get a report that says Silver Spring, wanting to know, is this downtown Silver Spring or is this greater Silver Spring? Even on our own the way we talk about it sometimes, you have to ask for clarification to know which are we talking about here.
Thank you. Thank you for elaborating on that.
And none of it makes it any better. It wouldn't matter what name you put on it. Crime is crime. It makes people feel safe.
And just so we're very clear, there are real issues, and there are real issues that we're working to address. Yeah, and the way it's characterized doesn't change the fact it doesn't. We're not trying to dismiss the way people feel as being wrong. But obviously the way it's talked about is different. That doesn't make it is not an issue that we can ignore, and where there isn't a significant focus. We've got a Silver Spring task force focused specifically on Silver Spring to address some of these issues, particularly as they intersect with the business community. And so there are efforts that are specific to this area to address it. And I don't want it to be misconstrued that just because we think that there are some unfair connotations tied to it, that there aren't real issues that we're working to address.
I get what you're saying. Absolutely. Thank you.
Thank you.
Okay, any additional questions for our panel? Going once, going twice. Okay, thank you very much for joining us today. As I think Dr. McNeil said, and all of our healthcare professionals, we encourage everyone to and recommend for people to wear a mask in really crowded places. If you have not received your booster, please get one. And if you only have one, please get a second. Those are the things we can do to better protect our community.
Hey, Barry, there's one more thing I wanted to mention. This was, we're getting ready for the Martin Luther King Day celebration that's going to be January 16th. And it's the annual birthday tribute and celebration that we hold in Montgomery County. And so despite it being a holiday, we're not don't treat this as a day off. And this isn't a day to go out and shop store specials. This is really, trying to get people to focus on using this day to volunteer and help serve the community, to help build up the community and help us address, some of the very issues that, we just got finished talking about. His work was, centered on making communities stronger and better. And so honoring him this day is something the county's been doing for a while now. I was actually at the March on Washington in, 63. I'm not going to say that I knew the profundity of the speech. The speech was moving. I had no idea it would become, kind of a hallmark with, all the, the quotes and context that it was in. But for me as a 13-year-old, it certainly had an impact on me. And I was glad to have been there, and glad to have been there with the people that I was with. I want to point out that the tribute's going to be at Strathmore, and it's a free event. It's Monday at 4 p.m. It's going to feature acts that are inspired by Dr. King's words, and it's going to be an opportunity to collect toiletry items for the homeless. So if you can come, you can reserve a ticket. It's free, but we're trying to make sure everybody can get in. We don't want to have a line of people who can't get in. So if you can reserve your ticket at the Strathmore, and if you can bring toiletry items that we can collect and distribute to homeless people after that, it would be greatly appreciated. So I just wanted to make that note before we got off today.
Thank you, Mr. County Executive, and a very important note it was. So thank you everyone for being here, but we hope to see you there on Monday. So thank you very much and have a great day.
Thank you.
Thank you, everyone.